Let's talk of interstitial lung disease, colloquially known as lung fibrosis, acronym being ILD. In earlier times, this was a damning diagnosis with few options, hardly any therapy, and poor prognosis. In modern times, we can do a lot for the disease. Early suspicion, catch the disease early, don't ignore any long-standing shortness of breath or cough, perform a good evaluation, and then, if required, do a CT scan, a high-resolution CT scan, which is so easily available in modern times. We then follow it up with an appropriate lung function test and diffusion capacity, and also a walk test to see their functional capacity. We then order a slew of investigations by blood test to try and find out the cause, and then we sit together and decide, do we have a diagnosis? There are around 100 types of ILD, and it's important to find out what is the etiology, because etiology guides management, etiology guides prognosis, and etiology guides the way you're going to counsel patients. And if at the end of a clinical workup, we don't get a diagnosis, we offer them a lung biopsy. And we're happy to say that we at Vayu Health and Chest and Sleep Services have been the leaders in doing bronchoscopic cryobiopsy for ILD, which has not only made a diagnosis, but helped many patients in trying to improve their overall therapy and outcome. We then put all this together with what's called a multidisciplinary team and then try and clinch a diagnosis of what sort of ILD, which sets the stage for therapy. In modern times, there are new anti-inflammatory agents which can be utilized, and those are used in the care of these patients. We then combine it with what is the modern mantra of healthcare, multi-modality care. In short, we again admit, like in COPD, it's not only about the medications, but also add pulmonary rehabilitation, which we also have in our center over here, and try to also cement it with interdisciplinary meetings, periodic follow-ups, and of course, prevention by vaccination. When we do all this, we're able to impact on the outcome much better. And in case we can't do that or they progress down the line, we are also equipped to manage with lung transplantation. In short, in this brief video, we've given a total overview of 50 years of this disease, and we shall be following up with more details so as to try and make your understanding better, simpler, and more productive for patient care.